Brad Wall is in Ottawa after attending a major health policy conference near the national capital. Had a chance to catch up with the Premier a little earlier today to find out what the rest of the country can learn from major healthcare reforms in that province, along with a couple of other issues. Premier, I want to start off by talking about the health policy conference you were at in Montebello, Quebec, just northeast of Ottawa. Were you telling the conference about Saskatchewan's success in cutting surgical wait times by involving the private sector?
That was part of it, absolutely. It's part of the innovation we brought to healthcare in the province. And by the way, let me just say by way of introduction, or maybe disclaimer, we have a lot more work to do in Saskatchewan. Our ER rooms there's too many people waiting in those emergency rooms. Our wait lists are still too long. We have a lot of work to do, but we've had some success with innovations, including a greater involvement by the private sector. We have implemented a couple of years ago something called the Surgical Wait Times Promise or Guarantee, where we're committing to the people of the province that they're going to have the surgery they've been prescribed within 3 months of that diagnosis. And we are making progress. We're halfway through that 4-year commitment. People waiting longer than 18 months is down over 95%. People waiting longer than 12 months is down over 79%. Every category is coming down. Part of the reason for this success is that we have engaged the private sector. We're using
more clinics?
That's right. We're using private clinics in the province to increase the capacity. It's part of the public system, and it's caused some debate. But I can tell you that even though we have a history of Medicare in the province of Saskatchewan, the advent of private clinics has helped see these numbers come down, the wait times come down. No one's burst into flames. And if you asked a person in Saskatchewan, would they choose timeless ideology or timely surgery, I think they'd pick the surgery.
And is it a case of you show up with your provincial health card and...
Well, you're referred. It's a referral, just like you'd be referred in the public system. And we just have greater capacity now that we have the private sector involved. And so, obviously, again, I think it's been well received, even though there was a bit of opposition. We have our own opposition in the province, and even some in the public sector unions were very upset about it. But really, there's not much opposition to these things anymore because surgeries are getting done. We're reducing wait times.
You talked a little bit earlier about emergency room wait times. They're notorious across the country.
Right.
How are you going to succeed where others have failed?
Well, it's interesting because we have a commitment, we have a promise. We, by the way, believe that we ought to set goals in government and then be willing to be held accountable to those goals. We have with respect to nurse recruitment and retention. We have with respect to the surgical wait times initiative, and we've set some other goals that are bold, including people ought not to wait in an emergency room. And it's interesting in Canada that this would be a promise that would shock a lot of people because it's an emergency room, and so it might make sense that people should get emergent care in an emergency room. Now, we're not promising something that only exists in Shangri-La. We have had our ministry officials and others go around North America, go to different facilities, most of them in the United States, and see emergency rooms where it's 5 to 10 minutes and there's triage. You're getting some attention, and so we know it's possible. And we're going to do what we did with the surgical wait times piece. We're going to look at best practices and try to make them right for our province's realities. And we're going to try, and we're going to risk being held accountable to these goals because I think people deserve that in terms of government that's prepared to say, here's the objective, and if we don't make it, you can hold us accountable.
I want to ask you about the federal government's move to speed up regulatory reviews of major projects, especially in energy and mining. I know that's a big part of Saskatchewan's economy. What are your thoughts on the direction the government's taken?
Well, we would like to see sort of an efficacious regulatory system and even a labor legislative environment in our province as part of what we call the Saskatchewan Advantage. We've lowered taxes so that a family of 4 takes home more in our province than anywhere else in the country before they have to pay any taxes. We have a balanced budget, the only one in Canada. We're reducing debt. But the regulatory piece is important. So we've been advocating to the federal government that we have one project, one assessment when it comes to the environment. Our point is this, that we don't want any less rigorous environmental assessment when it comes to natural resource projects, but we'd like to have only one. We don't see the reason for the delay and the duplicative nature of what exists today when our ministry is involved and the feds are involved, and you get a situation like we've had with one particular resource company where they thought they were good to go, and then I think it was DFO, Fisheries and Oceans on the Prairies, decided that a dry creek bed needed to be protected, and the company had to build a bridge over it. And they designed the bridge, submitted it to DFO, and were delayed again because DFO said, no, the bridge isn't high enough to accommodate boats underneath it. It's a dry creek. I mean, that's an anecdote, but there's too many of those anecdotes. And so we're saying, let's have that rigorous environmental assessment. Let's have duty to consult, but let's have some common sense.
But you know, the provinces are going to have to play an increased role when it comes to these reviews if the federal government gets its way, and they will with a majority. Is Saskatchewan ready to play that role?
We are already. You know, BHP is building one. We hope they'll give the green light. They're already doing a lot of work on what will be the largest potash mine in the world. They've had to apply to the Ministry of the Environment, work with the Ministry of Energy and Resources on permitting. We have the only one in the country, I believe, we have an environmental code, a results-based code that we believe is there to protect the environment, but also strike the balance between that and wanting to create an attractive business climate. So we're doing the work anyway, and we'll continue to do it. And now we can, I think, reduce some of the delay and balance that need for environmental sustainability and an attractive investment climate.
Let me ask you something that might be a little bit sensitive. Obviously, Alberta is going through its election campaign. The campaign seems to have gotten nasty at some points, especially if you're a social conservative. You've got a target painted on you. You have any thoughts on how things have gone there in that regard?
No, I should not weigh in on anyone else's provincial election campaign. I'll just say this, that you know, there's a real advantage in Western Canada today, and part of it's born of the fact that the three provinces, the three westernmost provinces, have created the New West Partnership, where we've reduced interprovincial trade barriers, where we're cooperatively marketing around the world the opportunities in BC, Alberta, and Saskatchewan, and you know, we've created the largest sort of free trade zone within NAFTA in terms of GDP, and it's a real advantage. So we trust we trust that whoever forms governments in any of those three member provinces, that we'll continue to build on that New West partner.
You're going to have to work with them.
Absolutely, and we'll be happy to do it.
All right, Premier Wall, thank you very much. Appreciate it.
Thank you.